Building health systems can't be done from the top down. That's the key philosophy of Management Sciences for Health, a non-profit organisation that works in 60 countries around the world to close the gap between knowledge and action in public health.
We believe that strong health systems create greater health impact. Health systems we define as 6 fundamental components: leadership and management, service delivery, human resources for health or health workforce, health financing, medicines and vaccines, and information. Those are the 6 components of a strong health system. Our approach to health system strengthening in the 60 countries in which we work is to work at 2 key levels. We work at the national level with government to build their leadership and their management and their governance capacity. And then with Ministry of Health, with government health services, with NGO health services at the community level to really develop practical systems that actually work.
Ethiopia is a country with a scarred history, and today the spread of HIV and AIDS is a major concern. MSH is working with the Ministry of Health and a wide variety of partners to scale up prevention and treatment services for HIV and AIDS.
We feel like for us to be able to address the current and future needs of HIV and AIDS, we've got to look at the health systems as a platform for implementing interventions. And in the case of MSH, we look at health systems as also including communities and households because they must play a part in the delivery of effective and sustainable health systems.
And involving communities has meant relying strongly on local health centres like this one.
One of the great advantages of the health centers is that they're closer to the community, therefore they're closer to where the patients live. So it really tremendously increases the access to comprehensive HIV/AIDS services for patients instead of having to travel long distances to go to a hospital.
This is Kadest, who's HIV positive. She's come into the health centre to see her case manager. The case manager is a new level of health worker. He helps Kadest to access the services she needs, empowering her to take control of her situation and being there to support her.
ዋናው የኬዝ ማኔጀር ተግባር የአርቲ ክፍል ውስጥ ከተለያዩ ክፍሎች ወይም ደግሞ ከቢስቲም ሊሆን ይችላል ከፒኤምቲስቲም ሊሆን ይችላል ከአንደር 5 ሊሆን ይችላል የተለያዩ ተመርምረው ራሳቸውን ያወቁ ሰዎች ወደኛ ክፍል ይመጣሉ። ወደኛ ክፍል እንደመጡ በቀጥታ የመጀመሪያው ስራ የሚሆነው ምንድነው? አድሄረንስ ካውንስሊንግ ነው የሚሰጣቸው። አድሄረንስ ካውንስሊንግ ማለት ከአንድ ሰው ራሱን ተመርምረው ካወቀ በኋላ ከመድኃኒቱ ጋር ያለውን ቁርኝነት በደንብ ለማጠናከር ከመጀመሪያው ጀምረን ያው የምክር አገልግሎት ነው የምንሰጠው። የምክር አገልግሎቱ ለሞኔል አስብ ያለውኝ የሆነ ምክር ነገር ብትሰጡኝ ያስባለሁ።
MSH believes a sustainable health system must be built on community support and learning. Kadest is also a community volunteer. She goes to a coffee ceremony, which is a strong Ethiopian tradition that brings people together to share her experience and encourage others to get treatment and support.
Typically in the coffee ceremonies, the community volunteers will admit that they are HIV positive. Many will be on antiretroviral therapy and they'll look very healthy. So there'll be examples of what we call positive living. They're healthy, they're successful, they're working, and it's all because they're accessing the services of the health center.
በጣም ጠቀሜታ አለው። በእነሱና መሰል ሰዎችን አግኝቼ በፒሲቲ እናቶች ለእናቶች ድጋፍ እንዳገኝና እንደኔ አይነት መሰሎች እንዳሉ አውቄ አገናኝተውኝ ለካስ መኖር ይቻላል ወይም ደግሞ ምጡት ማጥባትም ይቻላል አጥብቼ ማሳደግም ይችላል የሚለውን ትልቅ ግንዛቤ አግኝቼ አይደለም አሁን ለራሴ ከዛ ከጤና ጣቢያ ያገኘሁት ዕውቀት.
The work of MSH in Ethiopia shows that success comes when health systems are designed by the people who need them.
One of the founding philosophies of MSH is something called the Tao of leadership. Go to the people, live with them, love them, learn from them. Begin with what they have, build on what they know. But of the best leaders, when the work is done, when the task is accomplished, the people will all remark, we did it ourselves.